Hello, everyone. Welcome to our focus week on kidney and urinary tract disease. This week, we are addressing problems that we see in both our cats and dogs related to dysfunction or dis-ease in the urinary tract. And today, I am really honored to have Julianne Lee from Adored Beast joining me because she does homeopathy, which is not my thing. But she's also a huge fan of feeding the right diets and has done so much research on supplements and gut health and feeding our pets correctly. And so I asked her if she would be my guest today and we could have a conversation about urinary tract crystals, because I don't know about you, Julianne, but I get probably an email or a private message, something about crystals or something in the social media feed, literally daily. Do you get a lot of that as well?
Yeah. And at my practice, my clinic was one of the main veterinary hospitals for a big foster and adoption place called Vancouver Orphan Kit Rescue. And they would rescue ferals and cats and kittens, probably about 2,000 a year. So We saw a lot of them. So I saw a lot of cats, a lot of crystals, a lot of urinary tract diseases, a lot of dogs, even towards before I moved out here, which was 10 years ago, more and more dogs with crystals. Like, I didn't see it so much at the beginning. And then I started seeing more and more dogs with issues with crystals. Yeah.
So it's funny, when I first started in practice, didn't know anything holistic at all, being a little baby vet 40 years ago. And I remember getting urinalysis results back, and there'd be crystals in the urine. And my employer said to me, "Oh, it's just normal for them to have crystals. We don't worry about those." And I went, okay. And so that's kind of where I was for a long time. And then prescription diets came out and became very popular. And so I worked in a practice for 5 years where we sold more prescription diets than any other practice in the country, which I look back on that and say, oh my gosh, what were we thinking? Well, yeah, I didn't know any better.
Oh, yeah.
But we still see this all the time. We do a urinalysis on a cat or a dog, some crystals show up, and boom, they're prescribed a prescription diet, which usually is a dry diet, and we can talk about why that's an oxymoron. But they're prescribed a prescription diet for life because they had some crystals in their urine. So I'll let you run with that from there. Why is that such a horrible thing to do to these poor animals?
Well, I mean, from my perspective, I remember, oh my gosh, like 1997, doing a lecture about how cats, shouldn't be eating anything dry. Like, you talk about an oxymoron, right? Like, they grew up in a space, or grew up, they evolved from a place in the world that really didn't have fresh water, like the desert, right? So where were they getting their fluid from? They were getting it predominantly from the blood of their prey. They weren't meant to eat a bunch of dry crackers and then drink a whole bunch of water. And I was trying to say to people, the absorption rate is different. Like, it's like the way their body has to break down the dry food. So instead of giving moisture to the body, it sucks moisture out of the body in order to break down the dry food, which then dehydrates them, which then changes their pH in their urine, which then, right? Kidney disease, the whole 9 yards. It's just a big merry-go-round. But diet is a huge one. It's a massive one. And the more animals aren't being allowed to go out and hunt, like, it's just a fact of life. They're not getting blood. They're not getting that. I'm a huge believer that they process blood different than they process water, right? The way the molecular structure of blood happens. it systemically hydrates them in comparison to water, like with people. So I think that that's a huge part, is the contribution of dry food for dogs and for cats, and changing their pH and in their urine, and also making them sort of clinically dehydrated, right? Their specific gravity isn't what it should be, and the whole 9 yards when you're looking at that. From a perspective of, seeing crystals all the time, I know, I understand that. And that was a lot of, my colleagues, friends, different people that I would be looking at. That's the same thing that they would think. Oh, you see them all the time. You don't worry about them unless they start showing pain. And then, or you get the exact opposite. The minute there's any crystals, they go on this like lifetime terrible food that contributes to kidney disease on top of everything else.
Exactly.
So it's crazy. So yeah, like, I think that a bunch of things fall in place with stuff like that. I think that diet is the biggest one. They're like not eating wet food, of like
Right.
not, their food not having its own moisture content, not enough exercise, not being able to get outside, stress levels, giving them antibiotics, so then the it doesn't have the proper bacteria in the urine. Everyone thinks that everything should be like bacteria free. That's not necessarily true. There are certain bacterias that actually support the body to those particular bacteria to adhere and then be flushed out through the urine. So I still feel like we're not, from a conventional vet perspective, crystals are still something that is so misguided.
I 100% agree, because I see these animals that are sentenced to a bad diet, basically, because they had a few crystals. And then, of course, if the crystals disappear, and the reason they disappear is because there's an acidifier in a lot of those foods, methionine, which is an amino acid, but it's an acidifier. And so that helps dissolve the crystals. But then what I started seeing in practice, because we were dissolving struvite crystals and we were chasing those down and trying to lower that urine pH, then all of a sudden we switch and we have oxalate crystals, because we've acidified the urine artificially, not with diet, but with a supplement or something that's put in there. And I remember when I was first in practice, oh my gosh, so we'll go back 40 years. When I was first in practice, we used to have a lot of cats, because of course they were all eating dry food, because, new convenience, yay. And they're addicted to it because of the palatants that are sprayed on it. But all these cats were having crystals. And so we had these red methionine tablets. And you always knew a client who had a cat on those, and they had to pill their cat 3 times a day with these stupid things. But you always knew a client because their hands were bright red. You could not get that dye off. And so clients would come in and I'm like, wow, like how bad is this, that these poor people have to live with bright red hands? And looking back on it, it's like, oh my gosh, all we had to do was feed them a species appropriate diet, and we wouldn't have had clients walking around with red mittens on. And it was, the whole thing is it's absurd. It is absolutely absurd what we have done.
Yeah. And I think the key point is, when you do species specific, the body has a tendency to know what pH is normal for that particular animal, right? Because that's the problem, right? When you are giving too much of something to make something too acidic, you counterbalance it often. Right. I mean, some animals you don't, some animals are fine because their pH is so high, but the ones that aren't elevated quite as much, you can have that reverse effect and cause a counterbalance with oxalates. So, feeding a species specific diet, it's much more geared to the independent animal being able to produce the acidity level that they need, right?
Exactly.
Rather than it being forced into something.
It goes back to, you can't fool Mother Nature.
Nature.
We
No.
keep trying. So let's talk about, so first of all, we need to get them on a species appropriate diet. So if you have a dog or a cat who is eating a dehydrated, dry, particularly a highly processed kibble, we need to move away from that. And what will happen if you can get them to eat a high moisture diet, and I'm not going to go to high moisture as in canned, I'm going to high moisture as in species appropriate, without all the carbs and things in there. The first thing you're going to notice is your animal is not emptying the water bowl like they used to. And so I get emails with that a lot. Oh my gosh, he's not drinking. How do I get him to drink? I'm adding water. I'm adding bone broth. I'm doing this. I'm doing that. And it's like, hey, look at that. The diet is actually doing what it's supposed to. It's giving the moisture that the animal needs. So it gets our cats back to their prey model diet or something closer. But let's say, we've done all that. We've still got some crystals, and maybe we've got a UTI that has sprung up because of the highly concentrated urine not flushing the bladder. I know that with Adored Beast, you have designed some really, really cool products to help these animals that are struggling with inflammation in the bladder and crystal formation and that sort of thing. So I want you to talk about some of the things that go in. One protocol in particular is the Easy Peasy protocol, but I want you to talk about what goes into those protocols and why those ingredients help. Why are they there?
Well, I think one thing too that I wanted to touch on is this sort of triad thing that I used to see, which is like crystals, bladder infections, and then something called interstitial cystitis, which, everybody knows what that is, but maybe some people out there don't know, which is sort of, some people refer to it as sterile cystitis, which just means that it has nothing to do with bacteria or infection at all. It's just a chronic inflammation in the bladder wall. But the animals look like they have a bladder infection. They are constantly peeing. They're trying to ask to go out. They're peeing inappropriately, and they can even be peeing blood from the straining and the wall of the bladder sloughing a little bit from the intense inflammation. It's also incredibly painful. It's a really, really painful situation. So I decided in my clinic at the time, this formula came from my clinic because I saw lots of these patients. And one of the big things we talked about was cranberry, right? But in this formula, we use a really, really small amount. We just have like a hint of it, just to try to help with for those that do have a high pH in their urine, but nothing extreme. Like it's definitely not even a therapeutic dose, because my concern is exactly that. Once you get them on a species appropriate diet, you really don't want to be flipping them over into something that is like extremely acidic. Another thing that I use in the protocol is something called D-mannose, which is a lifesaver when it does come to infection and prevention of infection. It's a nutraceutical that actually binds bacteria. And then the bacteria is drawn, like the ions of the bacteria it's almost like a magnet, is drawn to the D-mannose. And then the D-mannose actually helps to flush the bladder. And when the bladder flushes, the bacteria goes along with the D-mannose. So it's really good when they have infections. It's also really good as a prevention, to try to keep that from not happening. A lifesaver is something called N-acetylglucosamine, or NAG. It is literally a natural anti-inflammatory for smooth muscle. So anything like bladder wall, intestinal walls, lung walls, even sinuses, any kind of mucosal lining that has inflammation. So it immediately starts to help with inflammation in the bladder wall. When the bladder wall becomes less inflamed, if there is some interstitial cystitis stuff going on there, and the animal hasn't been diagnosed with that, it happens really quickly. It's really helpful for pain. It helps with the inflammatory response and the pain response unbelievably. Then we put in marshmallow root, which is something to keep the bladder also not inflamed, but smooth, like moving around so it doesn't get stiffened. Uva ursi is an herb is a tonifying herb for the bladder. Nettle leaf, same thing. Then we put a 14 strain probiotic, and those probiotics are sort of handpicked by me that focuses a bit more on bladder health. And then larch is our prebiotic, which has an immune modulating effect. And then we put something called beef liver glandular in it. And the reason that people, when they see that, if they wonder what that is, it took me a really long time to get stuff that cats would eat. And I won't put any flavors in, because I did a deep dive once on flavors. We should do a talk just on flavors, because so many times you see this thing called natural flavors, and then you look at the certificate of analysis and it's like, it doesn't even have beef in it anywhere. Like it's crazy. So when I look at liver glandular, the liver glandular is very supportive for all the glands and all the organs, meaning kidneys, pancreas, gallbladder, even heart. So we add that as something that tastes really good, but it also has an active, functional, perspective of it as well. So combining all of that stuff we've had unbelievable success with it. I used to use it in my clinic all the time for animals that are active. I basically say, just keep using it until they've been non-symptomatic for like a month. And then I routinely tell people to do it 4 times a year, just as a maintenance. But what is really cool comes along with a homeopathic remedy. And that homeopathic remedy is made from something called hydrangea and berberis. And hydrangea is a homeopathic medicine that's known to break down and dissolve crystals. And the coolest thing about homeopathy is it doesn't matter whether it's oxalate or stervites.
Cool.
It's just stones in general, or even calcification, like calcified calcium oxalates and things like that. Like different, it doesn't really differentiate between the stones. It just helps to break down and dissolve stones in general.
Awesome.
And then berberis is a very supportive homeopathic remedy for kidneys. Right. So I've got my eye on it as well.
So an animal that had some kidney disease, chronic kidney disease, this is fine for them to take.
100%. Actually, it's really supportive for them to take it.
Exactly.
Yeah.
Exactly. Yeah, I love it. I think, if I were going to sit down, not the homeopathy part, but if I were going to sit down and make a list of ingredients that I would put in something for bladder support, I would be right there in with this. So I love it when I find things. It's like, oh, I didn't even have to do that.
Well, what's so great about that too is that I formulated at my practice. So we were doing urinalysis all the time, and seeing animals with chronic problems, like problems where they are on the vet formula and they're still getting crystals and they're still getting blocked, cats that are still getting blocked. And, and you start them on something like this, and, you retest it's not like it's in your head and you're thinking it's happening. We're redoing the urinalysis and seeing that there's no crystals and that the pH is balanced, and, it's really, I always find it so rewarding when you can do the diagnostics along with it when you're using just natural support, and you see all of this amazing stuff that happens.
Absolutely. And on that note, I will say that I find that veterinarians do not run urinalysis nearly enough. It is such a crucial part of diagnostics for our animals. And I mean, I had clients that would come to me with a 12-year-old pet, and I'd say, okay, well, we're going to do complete lab work. We need to get some urine. And they would look at me cross-eyed, like, urine? Nobody's ever asked me for a urine sample. We've never gotten urine tested on I mean, how do you get to be 12 years old and never have a urine test run, especially when you have a history of all kinds of clinical problems going on? It's just, so that's my little public service announcement for anyone watching. get urines checked. I mean, it's so crucial. And frankly, you can get the urine test strips and you can check urines at home. Particularly, it's not going to test for crystals. It doesn't do that, but it will tell you if there's red blood cells in there, white blood cells in there. It'll tell you what the pH is so that you can know what is normal for your animal, but then also if it's running really high or really low. Or if the specific gravity is coming up really, really high, it's like, oh, we need more moisture in here. So really critical, particularly if you have an animal who has a history of urinary tract infections or repeat problems, it's really important to monitor. So that's just, unfortunately, veterinary medicine is getting so expensive for a lot of people. So anything that we can do from home just for monitoring, and then when we see a problem, then we can get the full
100%.
urinalysis done. Absolutely.
For sure.
So,
and you can get that. You can get nose orb. You can also get nose orb, right? Like you can ask your vet for nose orb so that you can test it.
Yes. So the veterinarians carry one called nose orb. Yeah. Yeah. We have a different crystal litter in the warehouse here. Made by the checkup company. Yeah, they actually. We have we have the little kits with the peepholes with the little cup for collecting from the dogs, and then we've got the non-absorbent litter for the cats. So even with kitty cats, you can get urine samples at home. All you need is a clean box and the non-absorbent litter, and when they pee, it's like poof, you've got a sample, and you can test it or take it into your vet. Because we all know that putting your cat in a box and dragging him off to the veterinary clinic to get the urine sample is just one more stress that the cat doesn't need, and you sure don't need.
No. The other thing that when I was leaving my practice and coming out here to do ABA, that I also thought might be contributing to is the early spays and neuters. Especially with male cats and the inability or the thoughts of the urethra not actually becoming as big as it should get, right? Like the urethra becoming stunted. Therefore, the crystals are irritating it sooner. They're getting spasms. So sometimes I think that can be a contribution as early spay and neuter to especially for male cats. I don't know what your thoughts are on this.
I agree, and it's funny. The practice where we sold all the prescription diet, the one thing that I can say about the owner of the practice is he would not allow neuter of male cats until at least 9 months of age, which was at the time, and frankly, even now, that is still goes against what most traditionalists are saying. Like, let's get them neutered at 4 months. Let's get them neutered at 6 months. And then we feed them in an appropriate diet. And then we wonder why they have problems with crystals and blockages and cystitis and blah, blah, blah. So, I agree.
And what's your thoughts, just to tell people that if they do have a cat, especially a male cat that is showing signs of being blocked? Because I still find, a lot of clinics just immediately reached to catheterize them, right? And for me, what we found to be the best was to give them an antispasmodic, like a highest dose of an antispasmodic as we could. And often that didn't, they didn't then require to have the actual catheter. I mean, obviously we monitored them in case they did,
right?
But I'm still finding that not enough people are doing that. What do you think about that?
I would agree. And the other thing that we started using before I left practice was we would start lasering them and using cold laser over the blocked area. So basically over the urethra. And a lot of them that would very quickly take that inflammation down, and that would be enough for us to get them going. So I think there's a lot of things that we could and should be doing differently. So, but the first thing is fix the diet. And then if they are having problems, definitely give them some supplementation to take that inflammation and pain and help dissolve the crystals. So I love this stuff. And I'm very grateful that you like to do research and put all these things together. So we're very appreciative. And I am very appreciative of taking time out of your busy schedule, and you've got construction going on at your house and just so many things going on, and you're still willing to come talk to us, and we really appreciate it.
Well, thank you for having me. It's always a pleasure to talk to you.
All right. We'll talk again soon.